We had the privilege of hosting a session yesterday called Social Media for the Hematologist. In my role as the chair of the communications committee here for ASH, we had wanted to design a session that would not only introduce the concept of social media and specifically Twitter to our members, but to very clearly demonstrate to them that this has really become part of our medical practice in research and education. And we wanted to be able to convey that message to them with multiple examples of individuals who are doing this so that people could understand the value of it. From a novice level of individuals who had really never heard of Twitter, known much about Twitter, and so we provide an opportunity for them to sign up an account and begin with them. We had experts there to facilitate them. Or for people who are a little bit more advanced to understand how they can use the platform more effectively in the work that they did. So we had Dr. Mike Thompson, who is very well known on Twitter with about 12,000 followers, who reports at hematological and oncological meetings around the world and various updates, explained to us a little bit of the evolving role of Twitter and the role that it's playing in cancer care in general. And then I had the privilege of just interviewing a series of individuals sharing their experience with Twitter and how it's improved their professional experience. Examples of those would be, we had a patient who is a very strong patient advocate with thousands of followers. She goes with the handle myeloma teacher. And so there are so many myeloma patients around the world that cannot get to meetings or may not fully understand the pure medical literature, and she's able to digest it for them in a way that allows them to understand what's happening on the cutting edge. Similarly, we had physicians who use Twitter in their research practice, in collaborating with others and reporting back key information from meetings, or potentially even reaching out to the public to accrue for clinical trials. We had a physician from Australia who travels a lot here to North America to other meetings, and his followers back in Australia have the privilege of, across borders, across time zones, hearing about what is going on, and he can convey back information to them. So it was really a remarkable session. We packed the house with 500 individuals. We had some who self-identified as novices, others as intermediates, and a few as experts. We had our own hashtag of AshSM, which you can look up and see. We had a live feed on the screen, and individuals were commenting and tweeting throughout. I had joked a little bit about creating a form of ADHD where people were tweeting and listening to us at the same time. But this is the age in which we live, and this isn't just a fun thing. Social media is great for fun things. Mostly people would use Facebook or Instagram for those kinds of things, but we focused on how it could be a genuine platform for professional use. We even made a joke about my ridiculously long name tag here, that I was given a series of badges for my probably too extensive involvement at ASH, and we gave it its own hashtag of #GiantRibbon. So we had a little bit of fun with it, of course, as well, but we had, to conclude, it was remarkable. We demonstrated that the hashtag ASH15 was trending in the top 3 hashtags in all of North America, and that our social media session itself was trending in the top 30 hashtags in North America, just from our small group session. So this does have an impact, and it reverberates really around the world, and we were thankful to provide that introduction to our members.